Another question that, I suppose that I have for you, and I think we've touched on this before as well, is about the importance of the community actively participating in terms of these conversations, in terms of something that Dr. Harish said as well, nothing without us, nothing about us without us, So if you could just touch on that a little bit.
So this is a very exciting development. I was really happy to hear that phrase because we say that a lot here in the US, nothing about us without us. Transgender and gender diverse people are often experiencing negative encounters in healthcare settings. And so they avoid healthcare at times. Just last week, my associate in my practice had a person who was assigned female at birth. That's terminology we often use, assigned female at birth or assigned male at birth. And this AFAB person was hesitant to go in for healthcare. This person was very uncomfortable as they're working out their gender identity, very uncomfortable with having a uterus and ovaries, and so had not gotten taken care of in a long time, and was having bleeding that was getting worse and worse. And then this person woke up, excuse me if this is very graphic, but very bloody and blood all over the place and very scared. And a lot of trans folks end up avoiding healthcare and then in emergency situations. So that's just one example of why we want trans folks involved in developing curriculum and in doing trainings. We also want people to have the opportunity to see the insights of exactly the experiences that trans folks can tell you about negative experiences they have in healthcare settings. A friend of mine who's a transgender man, for example, had an illness. It was probably food poisoning, but he had not had any genital surgery. And he's in the emergency room and was handed a handheld urinal. And he told the nurse, "I can't use this." And she's like, "Why not?" And he said, "Because I'm a transgender man and I've not had any surgery." And she then proceeded to give him a hard time and question him. "You're what, really?" And well, why would you want to change from being a woman? What's wrong with being a woman? And it just became this bizarre encounter that was not focused on his healthcare. And so we don't want y'all or the people who work with you, because even when you're trained, you're going to need to train and make sure the people who work with you and for you are advocates and sensitive to the healthcare needs of trans individuals. And then the last reason I'd say that we need to have representation of the trans community in these types of trainings is because we want people to know that trans individuals can be successful, productive, contributing members of society if they are given support and not discriminated against and are allowed to use their talents in the healthcare settings or other settings in which they function.